Not all soreness is the same, and what I want to talk about here is some of the warning signs that we talked about earlier this week about bone stress related things or stress related to potential injuries popping up soon. So if we are noticing that we are not recovering appropriately, where we are sore or we are achy for longer than a couple of days, despite either taking a rest day or a couple of rest days, we're still feeling fatigued, we're still feeling like we can't perform at our best, we may be teetering a line. We may need to either consume more fuel, make sure that we're staying hydrated enough, or we may need to change up our training plan slightly because it may be too much of a load for what we're able to tolerate right now. So one of the things that we need to pay attention to, especially if we're talking about shin splints, we're talking about stress reactions or stress fractures in our feet, our legs, or even in our hips, if we're feeling deep, achy, maybe even sometimes sharp, and it's focal pain, especially if it's on a bone, we need to really take it seriously. We really need to back off. If it's behind the shin and if it's in the musculature, it feels sore, it feels achy, fine. Especially if it's diffuse along the entire muscle, it's fine. If it's focal, specific, and sharp right on the bone, we need to be worried about it. If we're talking about the hip or the pelvis, if it's in a weird spot, if it's in our groin, if it's on the outside of our hip, if it's randomly in our thigh and we can't touch it, we may need to get some additional help. We may need to talk to our physician, our physical medicine rehabilitation doctor, or an orthopedist. Or if you're seeing a physical therapist for something else right now, mention it to them as well, so we can really figure out what's going on with you, really analyze this, because we don't want to miss this, because if we do, it may be putting you back even further. This is especially true, again, if we're not seeing any recovery within a week or a couple of weeks, especially if it's the same pain that gets worse with activity, especially if it's our running or high level cycling. So if you have any questions specifically about any pain that you're dealing with that feels weird or not consistent with taking a break, or you feel like you're continuing to struggle with performance, leave those questions or concerns down below so we can help connect you with the appropriate people. Make sure you like and follow for more, and see you in the next video.